Lisa, you have an exciting new program to help patients get access to healthcare. Can you tell me a little bit about it?
Sure. Janice, this is a new program that started in January 4th, and it is a provincial pilot that is running in several organizations, several hospitals in the province to allow patients to have a virtual appointment with an emergency physician from home.
So, can everyone use this program? Who can use it?
So this program is really set up for patients age 17 and older who live in the city of Thunder Bay and the surrounding area. And it's really focused on patients who need a medical issue addressed within the next 24 hours, who may not have a primary care provider or family doctor, and really need a fairly minor condition assessed within a 24-hour period.
So, this program is virtual, so you don't actually, it's trying to keep patients out of the emergency department, is that right?
That's right. So the program was really set up for several reasons. Again, during the time of pandemic, we really wanted to look at the opportunity for residents to stay at home when possible. So it really does allow an opportunity for patients to stay at home, to have a virtual assessment done, which would really limit the ability for patients needing to leave their home, go on city transit, or have to wear a mask. So it really does is a convenient service, but also reduces the spread of infection through our community. The other thing in regards to why we really wanted to do this is with all the infection control precautions and all the physical distancing that's required, every little bit of space in the emergency department is so critical. So we wanted to offer this service to patients and to be able to allow more space in the emergency department for those that need to come in for more acute conditions. So it really does allow us to use our space better in the emergency department.
So, what kind of issues can people get help virtually with? Because I know some things you have to go to the emergency department. What are some of the things that you can do virtually, and what are some things that you should come into the emergency department for?
Yeah, certainly any kind of life-threatening condition. So if someone is having chest pain, is having signs of a stroke, somebody that's in a mental health crisis needs to come to the emergency department. They need to call 911 and they need immediate attention. Things that would be appropriate for the virtual care appointments would be things such as it could be like a urinary infection, it could be an earache, it could be something that has returned that someone had been on an antibiotic for a period of time and maybe needs to have that antibiotic extended for a period of time. Somebody that might have a sore injury to their arm or leg that may need an x-ray. The physician who does the assessment would be able to provide a referral to go and get an x-ray at a later date as an outpatient, or may actually also order laboratory tests following the appointment. So someone could go to Life Labs as an example and get lab work done following this assessment.
So basic things like the common cold, if you have a sore throat, those types of things are all involved in you'd be able to get help virtually for the stuff like that.
Absolutely, absolutely.
So Lisa, what's the process? How does it work?
Yeah, so it's actually quite an easy process. The first step is go to the Thunder Bay Regional website and you will see that there's information about ED Virtual Care. There will be some really important information for people that are considering a request or wanting to make a request for an appointment. And that's really to determine if this is right for you. Again, I mentioned conditions that are life-threatening. This is not for you. So it really gives a bit of a description of what would be appropriate conditions. As you said, minor things, minor complaints. So what will happen is there will be a bit of a self-screening, is what we call it. If someone determines that, yes, they're over the age of 17, they have a minor condition, they would request an appointment using the Thunder Bay Regional website as the first point. So they would go to the website, they would fill in their information, which would include address, email address. It'll be important you have an email address because it is virtual, phone number, OHIP card, all of the details that we would need to know about, and also reason for your appointment. So why are you requesting this? Once that information has been completed, there's a submit button, and that information would be automatically emailed to one of our clerical staff. The clerical staff will review that information and call every single person that has requested an appointment to go over any details, and also provide any support of instructions of what will happen next. So the clerical staff will contact the person requesting the appointment and give any technical information. And then following that call, they will receive an email with a link to actually connect with a virtual appointment at a certain time and instructions for the designated time for the appointment. So once that appointment time is there, the patient who has an accepted appointment would click on that link and they would be connected with the physician. Now, on that link, there's actually a button that provides you the opportunity to cancel an appointment. So if there is, for some reason, the need to cancel that appointment, we're asking patients to cancel the appointment if they have decided that they no longer need the appointment, so that it opens up appointments for other people.
Now, how many people are you hoping to see virtually in one day?
Yeah, so it actually varies. Our first day of opening, we saw 20 patients. Now the operating hours for virtual care appointments right now are from noon until 6 p.m. So appointments are quite short. They're only 15 minutes long. And we generally see anywhere between 12 and 20 patients in a day.
Wow, that takes a lot of people out of the emergency department waiting room. It's great.
Absolutely.
So just to confirm, so in order to be qualified for the virtual appointment, you need to have a phone or an iPad or something, a quiet place to speak to a doctor, and as well you need to have internet. Those are the three main things that you need to have.
Those are the three main things. You need to be over the age of 17, and that's important. So mothers that book an appointment for their children cannot be allowed. So again, it needs to be for patients older than 17 years of age. Now, and they do need to have the ability for either they need to have a laptop, a tablet, or a phone that would be able to project video, and they need to be in an area where it's quiet and you're able to connect with a physician for 15 minutes and give that healthcare information to the physician.
Now, Lisa, you mentioned that this is for people who don't have access to a healthcare provider. What about people who do have a doctor but can't get in? Can they still use this service?
Yes, they can. Now, certainly this service is not replacing the primary care provider, though that would be your primary step for dealing with medical issues is attempting to get an appointment with the primary care provider or use of a walk-in clinic. Now, if that option was not available or was not timely, you could use this service to have those conditions addressed.
Now, I think the benefits to our community are pretty obvious. It's keeping you, it's so you don't have to make that trip to the emergency department. You don't have to put yourself at risk. You don't have to sit in a waiting room for hours. What are the benefits for the hospital?
Yeah, certainly that is the big benefit, is that it does help the community. It provides patients the service. And one of the things that we found through the pandemic is that many patients really are hesitant to come to the emerge department. So they may be putting things off. This allows someone to put a minor thing off, but have it addressed in a timely way. So when someone decides that they have a condition that needs to be assessed or something to be looked at, people aren't putting this aside and then coming in very sick. So it's really a proactive way to address medical issues that need addressing, and with the hope that you will not need to come into the emergency department or need to be hospitalized for that condition. And again, as I alluded, if we can reduce the open up space for 20 additional patients who have more urgent health problems as a result of this program, it provides more space for those patients. It allows us to distance those that are in the waiting room and allows the resources to and attention to go to those that have a more complex or more urgent need.
Lisa, I think this is a great program, and I know a lot of these programs are coming out of the pandemic because of the need for them. Do you know if this program will continue on after COVID-19 disappears?
We hope so, and I think that's really a really important question. Is that following your appointment, there is a survey that is sent to each patient, and it's important that they fill that survey out. So if there is ongoing benefit, if there is the opportunity to extend this program, it will really be helpful to get the feedback from those patients that have used the service. So it's really important for those to complete the survey because it really provides evidence and support of how desperate and how needed the service is in the Thunder Bay region. And should we be lucky enough that this is something that is continued on, we could look at expanding outwards of the city of Thunder Bay and look at the possibilities to reach people in more remote locations as well.
Lisa, thank you so much for talking to me about this great new program. I think it's such a good idea, and I think it'll really benefit our community.
Well, thank you so much, Janice, and I really hope everybody uses this opportunity to try the service if they need it, and please evaluate and stay safe in Thunder Bay.